distinguishing lifespan from health span. So lifespan is how long we are alive, and we want to contrast that with health span, which is how many years that we are living in good health. How can we cater a strength training program specifically geared towards health? What's popular in fitness culture, on Instagram, TikTok, whatever's popular fitness trend-wise, is not necessarily aligned with what's important to develop health and wellness. Why is this important? Well, the United States is, of the top GDP countries, #1. However, we rank dead last as it relates to health outcomes. Yet, despite the amount of money spent, the outcomes don't live up for the things that we care about as it pertains to healthy longevity. I'm curious, what do you want to be true in your marginal decade? In those last 10 years that you are alive, what would you like to be doing? So being able to get up, being able to have energy, to enjoy the time together, things related to mobility and walking around, not relying on someone else to do your activities of daily living. So sports participation, but also things like picking up something heavy off the ground, so being able to do that independently. So this is where our long game is. And then essentially our process is to reverse engineer what are the qualities necessary to be able to go for long walks in our last decade, to have the strength to pick up heavy things off of the ground. Sarcopenia is the age-related decline in muscle mass that will happen to everyone who lives long enough. And so if we build a really high ceiling, then we're able to maintain strength longer, reduce the rate at which it declines, and all of those inherently allow us to be functionally mobile for more years. But if we go in with a surplus of strength and bone density, sitting out for a week doesn't compromise us as much as it would a sedentary individual. A properly dosed strength training program can reduce the risk of so many bad things. I just spoke to the sarcopenia aspect. And so if we stress the muscles in the right amount, and we allow for proper recovery, we build strength. When it comes to a certain age and that muscle mass starts to decline, we have a much greater reserve to build off of. The same applies for osteopenia. So osteopenia is the age-related reduction in bone mineral density. But if we stress the bone, then we can have an increased reserve in that manner. But how do we stress the bone? Things like weight-bearing exercise elicit stress to the bone. Having more strength, having more capacities reduces the risks of falls and injuries. And we know that in older age, when someone has a fall, they are at a much greater risk of dying within 1 year compared to someone who has not fallen. And they're all related to a properly dosed strength training program.